Today is January 6, 2016. Dr. Jerome Gundersen joins Kay Wagner and Sarah Battison to talk about his 30 years at Gundersen. Dr. Jerome, as he is known, joined the Gundersen Clinic in 1969.
66.
1967.
I came here for 3 months before I went into service. So my date of hire is 67.
Excellent.
Which is, I didn't know, but it got into pension plans and stuff. And Tex had put some money in 67 that I didn't know about.
Well, then that's interesting because I was seeing confusing dates, 67 and 69. So that's great. You retired in 1999?
Yep.
Okay. And you were an obstetrician gynecologist.
Correct.
Correct. All right.
I always say baby catcher and womb snatcher because most people don't understand what an obstetrician gynecologist is, but if you tell them you're a baby catcher and a womb snatcher, they know exactly what you do.
Well, Dr. Jerome, in these interviews, we often have asked how emeritus physicians first heard about Gundersen. Instead, perhaps you could tell us, growing up in the Gundersen family, when you knew or how you decided to be a physician.
Well, I haven't yet. No, I didn't know what I wanted to do for sure. In college, it wasn't until my junior year that I finally decided to go into medicine. And I applied to medical schools, well, a bunch of them, but 3 of them that accepted me all wrote back and said they questioned my motivation. Because when you fill out an application, you fill out a thing, why do you want to go into medicine? You know, and I'm sure everybody wrote down they want to stamp out disease and save lives and do good work, etc. And I wrote down, I grew up in a medical family and I couldn't think of anything else I'd rather do. And they didn't think that was adequate. So I went down to the Harvard Medical School, this professor. First asked me about Uncle Alf, and then about Pop, and then about Adolf, and then about Sig, and then about Eric. And he was supposed to be interviewing me about my motivation. He was telling me all the Gundersens he knew. And he said, I never knew a Gundersen that wasn't well motivated. You're excused. That was my whole interview. But he must have given me a good word.
So you graduated from Harvard.
Yep.
And then you...
Adolf and Sig never graduated. I'm the only one of the 3 brothers that has a degree from Harvard, undergrad. I hold that over them.
You might want to explain why.
Well, they're too smart. They were there during the war. They went into Mass General Ottawa College.
So you trained then in UW-Madison?
I went to medical school, UW-Madison. I got accepted at maybe at Columbia and at Northwestern in Wisconsin. And I went to my advisor because I kind of like to go to Columbia because that's where Pop went. But he said, Jerry, a bird in the hand is worth 2 in the bush. So then when I went to Pop, Northwestern was $15,000 a year and Wisconsin was $5,000. So he said, you're going to Wisconsin. That's how I got there. It was a very good choice, actually.
Then you trained in Chicago.
Yep, 5 years.
Then the Air Force.
2 years down in Wichita, Kansas.
Did you ever consider not returning to Gundersen?
Yeah, sure. I came back in 67, before I went in the Air Force, to make sure. I've been offered some jobs down in Chicago, at University of Chicago and at Northwestern. And I came back to make sure I wanted to come back. And I decided I could stand it, so I came back. Actually, I didn't want to raise a family in Chicago. And Chicago medicine is a bit of a zoo. Everybody's on their own, and they all have set referral patterns, and you couldn't send somebody to somebody who was better because they wouldn't send people back. And it was a mess, so I decided to... And you'd have to live in the suburbs, probably have to work 2 or 3 hospitals and commute, so I figured I'll come home.
How many clinicians were here, do you remember, when you came?
Well, my original number was 60, but I think they were about 35 or 40 because they weren't, at that time, they weren't giving out the original numbers again. And so the uncles and all, Adolf and Sig and the rest all had, and Carlson and Harmon all had like 1 through 15 or something. I don't know, I think there was around 35 or 40, but it grew very rapidly.
Was there a particular mentor or role model that you had in your life?
Well, lots of them. No, my medically, you mean, or life-wise, or whatever?
Both.
Medically, Dr. Gardner was the head of the department at Northwestern, and he was a Wisconsin graduate and was very good to the residents. So he, I think I'd call him a mentor. And of course, family, I guess, all of them. One time there were 13 Gundersens here, I think. I'd have to count them up. But
Was there someone who pushed you competitively or otherwise that you consider made you a better doctor?
my wife, no. I better be careful.
Then I will ask, was being a Gundersen...
I think the biggest plus for me, medically, obstetrically, was Maharis. He and Felian came, and Libby and Schultes had sort of caused a rapid decline in obstetrical patients at the Institute because they insisted on no more than 20 pounds of weight gain during pregnancy, which turned people off. Well, that was what they were trained, and they were doing their thing, but they were sending people to St. Frantic, and Paul and I can call it Brand X if you want. Anyhow, when Paul and Greg came before me, and they started turning things around, really. So, and Greg was my mainstay as far as a consultant went. We worked together very closely. If I was in trouble in the operating room or the living room, I'd say, "Get Maharis." Most guys would have to call up somebody and tell them what the problem was, and they'd give you advice, and then maybe they'd come out. But Greg and I, they said, "Come on out." We never asked why. We just went out because we wouldn't ask for help unless we needed it. And that was for 30 years, roughly.
Was being a Gundersen family member ever challenging?
Just the name. No, I don't think so. It was a privilege. But
Well, and you referred to the others on staff who were your key partners as Maharis and Phalian. And
what was that, sir?
they were key. You had many key partners and colleagues that weren't family.
Oh yeah, there was. Actually, I was thinking of going into surgery, but Adolf and Sig came back, and they hired Murphy, who was an excellent surgeon. No, he was wonderful. Your father didn't like him, but he was a good surgeon. And so I knew I wasn't going to be much opening in surgery, and I wanted to do surgery, so I fell into OB gynecology. And had a wonderful chief down in Chicago.
You were definitely a part of the growth of Gundersen from a clinic to a healthcare system. Do you have any stories or observations you might want to share about that?
About what?
The growth of Gundersen?
Well, I think that Adolf and Sig were monumental in changing it from a partnership to a corporation. And I was in medical. I was in college, I think, when that happened. And I was never consulted about that at all. So, but my view was at the time was that they got Hayden and Tompkins and Murphy to come and join them, and I never felt that they had to convert to a corporation to attract people, because obviously they were attracting good people. But they felt that that was important, and that they finally overcame Aunt Carol and my mother, who basically wanted to leave positions for Eric, the heart surgeon, and me to come back and be partners. And finally, Adolf and Sig convinced Nana to quit telling Papa not to incorporate. And then Pop, who was the chief honcho out here because he brought in all the money with his surgery, convinced the brothers that they ought to incorporate.
And the reasoning behind incorporating, as you understood it?
Well, the reason was that Adolf and Sig didn't think we could attract good doctors if it was a partnership. And I just said that I wasn't sure that they were not confident in themselves because they were certainly attracting good doctors without it being a partnership. But they may have been right. They may not. It doesn't matter because it grew.
Please tell us about establishing the first nurse midwifery program.
Well, it wasn't easy because we had 5 of us, Greg and Paul and Roland and Rudy, and we were doing an awful lot of OB because we were coming in for our patients 24/7. We took care of one patient, came in for him. For 10 or 15 years, I did that. We all did it. And obstetrical load was getting, so the routine visits and the new OBs were taking up a lot of our clinic time. And there's also tons of gynae comes into this place. I mean, very few people start out in the practice in OB-GYN where all of a sudden there's all kinds of gynae to do because all the other doctors would send it to you. And so we needed more office time. And so I thought, because I trained in Chicago at a home delivery service, so I was used to midwives and very impressed by them. And so I brought up 3 times we ought to get a midwife to do our routine care, and we'd cover them in the hospital, etc. No. They didn't want one. But the 4th time Greg said, well, Jerome, you can get one, but you have to cover her. We won't. I said, fine. So we got Cindy Delano, who was a godsend because she was so good. And then after about 3 or 4 months, they all agreed to cover her. And she got Linda Hirsch, and they were our first 2 midwives. And they were very popular. They all were. It was a good service. It is a good service.
What made it difficult to establish this? What was the resistance?
Well, they didn't. For us, it wasn't much of a problem, but for the rest of the doctors in the state OB-GYN Society was against midwives because the doctors didn't want other doctors getting midwives because they'd steal their patients, and all the doctors in the state were on percentage of billing. So if they lost patients, they lost money, and so they were anti-midwives. I had a experience with Cindy. Went down to the State Medical Society when the Political Action Committee was meeting, because in the years past, the State Medical Society had lobbied against licensing midwives.
Excuse me.
And I went down there and gave a talk about how, because at that time, one of our midwives wasn't a midwife yet, had taken care of a patient in Madison, Paula, I think it was, but anyhow, she had been in charge of a patient. A patient called her in Madison and said she was bleeding. Paula said, go to the hospital. Well, she went to see if she'd gone, and when she got there, she had a previa. That's when the placenta comes first, and bled all over the place, and the baby had died, and she got there and took her to the hospital, and the city got a hold of it. And they started making all kinds of noise about what's this midwife doing, delivering babies at home. The baby died, the mother almost did, blah, blah, blah. That was about 2 weeks before I went down to medical society. I said, look, you guys, you better start licensing midwives because another one of these accidents are going to happen. You guys are going to really look bad. So they said, all right. And I said, you don't have to be in favor of them, but quit lobbying against them. And then Paul Offner, who was not exactly in my political nature, offered a bill to license midwives, and I went before his committee with Cindy and urged them that they pass this bill. Then Cindy and I got ourselves appointed to the committee that was going to establish the policies for the midwifery services in the state, where we then got it approved that the midwives had to work with a doctor, had to be a signed agreement, and it had to indicate where they're going to deliver babies, trying to stop home deliveries. And although I was trained to do home deliveries, I could have done them, and I would have had to set it up, but I was the only one with training in home deliveries. And Charles Gillette's second wife came to me and said, could you deliver the baby at home? Her name was Paula, I think. I don't remember what her name was, but anyhow, I said, sure, but Charles has to buy me the equipment. I have to talk to the police department and the ambulance services so that we have it all set up. So if I do that, we can do it right. And then she divorced him, so that ended that. But so I was tuned in to midwives. And we got a couple, and it's the first midwifery service in the state. There was one in Milwaukee by, I can't remember the lady's name, and she dropped it. And then after we got going, she took it up again, and she went around saying she started midwifery in the state, but she hadn't. But that was beside the point. We still have an active program. But that has been a big plus, because it not only attracts patients, but it's still true. The midwives spend more time with the patient in the clinic. They're with them during labor, and the doctor's there. We originally had a policy that when the midwife had a patient in labor, the obstetrician on call was on the floor up in OB, so that if there was a problem, they were right there. I'm not sure they adhere to that quite as closely as we used to, but because we had to, because I said so. But now they'll cover even from home maybe, and that has always made me nervous, because if they have a big disaster going on, it takes a while to get up there, but that's something different. But anyhow, they're still very busy, I think. Oh, actually, there's a picture did you get that picture that Terry Rinflish took of me out at the 40th anniversary of midwives? Of me and the 10 midwives, yeah. Out on Alaska. And I just stopped in at that. I wasn't really invited, but there I was.
So which anniversary was that of the midwifery program?
Pardon?
What anniversary was it?
40th.
40th, that's
When did St. Francis start their?
Took them a long time.
Did it?
Just about 5 or somewhere between 5 and 10, maybe less. Because of what I told you, they're a fee-for-service and percentage of gross billing over there. So they had the same problem until they came up with the recognition that we were growing. When I started here, St. Francis was doing, I don't know exact numbers, you'd have to look them up, but they were doing about 1,300 deliveries. Joe Durst had left the La Crosse Hospital and gone to St. Francis and that whole group. And we were doing about 750. And so they were more popular in our midwifery service, and the fact that we came in for everybody, build our service up, Paul and Greg and I. So in 1980, I think, you'd have to go back and look, we did 1,800 deliveries. And I'm interested to note, I just saw the numbers. We now have 10 midwives and 8 or 9 or 10 obstetricians. And last year, they did 1,750. What are they doing? They're doing gynecology, I guess.
You were very active at Gundersen and in La Crosse beyond your clinical practice. Can you tell us about any of your board or committee service involvement? I know you were on the Gundersen Medical Foundation board and worked with the Grants Allocation Committee and various others.
I was overextended. Dave Goodenough asked me once, how do you do all those things? Because I was active in town, too. I was very active in the Republican Party. And got your father to run. And then he decided he didn't want to listen to me and Walter anymore, so Proctor took over. You don't need that history, do you? We sat up in the chairs in the Lincoln building. That's where Charles Gillette had the whole top floor for offices, and he had a bedroom and a place in the back. in 75. Adolf ran in 76. And we were discussing about whether he should run or not. And finally, in the fall of 75, he decided he'd run, but he hadn't decided yet. But he said he wouldn't run as Dr. Adolf Gundersen. He's going to run as Adolf Gundersen. I said, Adolf, how can you not run as Dr. Gundersen? Everybody knows you are Dr. Gundersen. No, I won't do that. So that was one of the first confrontations that resulted in Baltz and I getting bounced out of control of things. Anyhow, that's ancient history. But
I mean, I noticed a list of some of your activities, and you were involved in the education committee. You were on a quality assurance committee over time. I guess I'm interested in your belief in education within the Gundersen Health System, its value, or I mean, if you see its value.
I have mixed emotions about our education commitment. Adolf and Sig didn't, obviously, in text, but when it didn't get going until well after I got here. And my opinion was that if I wanted to be in OB-GYN education, I would have taken a position at Northwestern or University of Chicago and not tried to set up education in lacrosse. So I never, I slowly adjusted to it. I think that's been fine, but I don't. I never felt that that should have been one of our main goals. I don't think it contributed as much to our growth as people like to give it credit for, but it would have grown anyhow.
What is your opinion of the research, both bench and clinical?
Research is built into practicing medicine. Everybody that goes through medical school or practices has an interest in some field where they want to look into something or other. And so research is part of practicing medicine for most people. So I never had any trouble with the research efforts at all. I wasn't too keen on the medical education chief wanting to run the clinic, but Dr. Overholt and I were close friends, and I drove him to poker all the time, and he routinely lost. He was in our poker group till he died, but he was very outspoken.
Well, you were involved in significant research early on, if I remember correctly. I don't know how it's pronounced, DSAD or DES?
Oh, I was DES.
DES.
I was instrumental in getting that going, and I was on the national DSAD board of directors. That was, it has since gone by the wayside, but I mean the whole thing. But at the time, I recognized that diethylstilbestrol created changes in the cervix that in a certain percentage of people led to cancer. And a sonogram, a picture of the cervix, would reveal who did or didn't have the changes. And so everybody, in my opinion, should have had a cervigram, and the nose with abnormal cervigram should be evaluated by colposcopy instead of doing colposcopy, which was a $600 deal, on everybody. It didn't make any sense. And that finally got overturned after the HPV came along, because they didn't understand the role. Although I did. I couldn't get anybody to do HPVs here either initially. Human papillomavirus. I was sending specimens to Mayo because they were doing HPV. And said, what are you doing that for? And I said, well, if they've got HPV, you got to worry about them. If they don't, you don't have to worry about them. And we finally started doing it here. But that was Verada. Verada was very instrumental in setting up our HPV testing. He and I got along well. He is a very good gynecologic pathologist, so we spent a lot of time looking at specimens together and stuff.
Did you publish in addition to that research? And
Oh, I've got 12 or 14 articles with my name on them. I can't tell you what they all are, but I have copies of them at home. The GS was one of them, but I can't remember what they all were about.
What would your colleagues say that you're known for?
Pardon?
What would your colleagues say that you are known for?
Shooting off my mouth.
Is that what,
Every now and then someone tells me they miss me. No one's calling it like it is.
what would you like to be known for?
Being a good obstetrician.
now I know you were active in the local public health and access, recently honored by what is now Essentials Clinic, renamed several times. First called Lacrosse Family Planning, was that?
It was first called Family Planning Clinic of La Crosse because I went to out up in Sig and Tex because we were doing too much family planning and I wanted to start a family planning clinic here in the clinic and they wouldn't let me. The reason they didn't want us to start one here is because it would aggravate Brand X because I didn't have it. And I said, who cares? Well, anyhow, so they wouldn't set one up. Well, we were spending too much time and effort at the family planning bit. So I went down, I got Sally Shaldock, or Steele at the time, and a bunch of the women out at the university together. I had an untold number of lunches at New Villa to get them to set up the family planning clinic in La Crosse. And then that grew. And that finally, then they had that 40th anniversary thing where they gave me a nice little 40-year thing. And then they broke their relationship with the clinic. They went independent. Good luck, people. I don't know where they think they're going to get the money, but because at that time, when we started it, people didn't have some place, especially if they had no money, to go and get family planning and a birth control pill. That's not true anymore. They can get in here, and they can. They don't need to go to family planning unless they have this idea they have to be anonymous. But and so I think and the clinic was paying their rent up there on the north side, and the help, and I'm not sure about the people even working there, but they decided they wanted to be independent. So good luck to them. I don't think it'll work. But
So it was initially funded by the clinic.
oh yeah,
Mm-hmm.
up until last year. At that 40th anniversary where they gave Sally and I the plaques, they announced they were breaking away from the clinic. I didn't know about it then, but that's their choice. I got out of going to board meetings and stuff. They were doing fine. Mike Motter is the main man out there. He was. I haven't talked to him lately.
Are there any fond memories of your practice at Gundersen you want to tell us?
Oh, I think it was all pleasant. I've always said I've been very lucky. I did just what I wanted my whole life, till now. No, I was very proud of what the clinic was doing and what our department was doing, and I never hesitated for a minute believing that we were giving the best medical care in the country. We had all the specialties, people had access to us, and that was important. And now it's a question of how big is too big, and how much you want to play on. You see, we're very highly respected as a clinic right now. I'm leery about how much time we're spending on being nationally recognized and all of the fancy things that we're contributing to, and leaving the practicing physician a little bit as second thought. And I think the new change is probably beneficial because it's turning back towards what the physicians want. But that's just I don't go to meetings, and I'm not on any boards, and it's just word of gut feelings.
But do you have any advice or words of wisdom to offer someone entering medicine at this time? Or did you give any words
Good
of
luck.
advice to Dr. Eric A?
Well, my feeling is that medicine changed a lot, and it always changed a lot. And it's, I think that the attraction of going into medicine is still there. People want to go and take care of sick people. Now, how they do it changes, and I'm not sure that I approve of everything that's going on, but it's still a mighty satisfying profession. So I think they'll attract good people in time. I don't know. That's all right. You can weed them out later on.
Did your son want to be a physician?
Eric? Not that I knew of. None of us were urged to go into medicine. I certainly didn't object to it, but none of us were given any type of pressure. Eric, why he decided to go into medicine, I'm not even sure of. He had a lot of irons in the fire, and all of a sudden he decided to go to med school. So then he got through over there in Madison. He created a few ways of his own. And when he wanted to come here, they told him he had to go to Toma to practice. And he said, so he went over to Milwaukee, and after 2 years they brought him back. He's quite happy, I think.
Any parting thoughts or other memories that you'd like to share with us that are important to you?
Well, I think that future medicine is up for grabs. We've got a government that thinks they ought to run medicine, tell doctors what they can and can't do, and who will or won't get paid for what gets done, and it's very scary, because nothing like having politicians telling doctors what they should be doing. And so I'm nervous about what's going on in Washington. And there's nothing I can do but watch that. But I think that the public has got to come to grips with the fact that they don't want the politicians managing their medical care. And if they do, then maybe they'll go back to private insurance. But it's just, right now it's a very hairy situation. We're sitting well for it because of our relationships in Washington and our size and all of that. But it still is not, in my mind, the way you want to practice medicine. And that's, we'll see what happens. I'll be around to watch it, maybe with a little luck.
A question. Can you speak to what the family dynamics were like when you came back to practice at the clinic? Was there a hierarchy, or once you joined the staff, you were all equal at that point, or?
Well, that's not a likelihood of in any group, but there were, like I said, 13 of us. Family gatherings. Someone at lunch, the doctors that are retired now meet for lunch every Thursday down at Diggers that are of the conservative brand. The liberal brand meets on Friday somewhere else with Braley, and I don't need to list them, but anyhow. And Ryan, who's not a conservative, but he comes to all of our lunches, he asked me how things got decided at the clinic back in the old days. And I said, listen, I used to have dinner at Grandpa and Grandma Gundersen's every Sunday night. And if you were of college age or older, you went. And they had a sit down with tablecloths and 3 courses. After dinner, all the men would go in the library over there, and the women would go in the living room and have coffee. And in that library, a lot of decisions were made about what they were going to do. And then what did I read the other day about Bob Ramlow, being a mover and shaker and getting the clinic to recognize the family practitioners, the internists, and give them votes and all this stuff. And because the Gundersens were running things, and it should be for everybody, etc. And then they commenced to elect Adolf and Sig president for 20 years. So it didn't really change very much until recently. Does that help you any? What else? I don't think that, the family had some dissident doctors in terms of their outlook on what the clinic should be doing. Gunnar Jr. was definitely not in step with Adolf and Sig, but that didn't keep the family from getting together and telling him he was full of it. No.
Anything else you want to add?
Well, I think that having grown up in a family and practiced here is nothing but a prideful thing. So, what more can you say? When your father ran for Congress, someone asked me, who was, I don't know, supporting someone else or something, what does Adolf know about politics? Because he hadn't been involved in much. Tex Charleston, the year before, when Vernon Thompson lost his race to Baldus, we sat out at the country club one day after tennis, and he said, "Boy, I sure hope that Thompson loses so Adolf will quit this politics stuff." I said, "Tex, you're out of your mind. If Adolf never lost anything in his life. If Thompson loses, look out, he'll get into it even more." And sure enough, he did. but
Thank you for coming in today.
yeah.
And if you think of anything else that you just think needs to be included.
I didn't write anything down, but I was told you about the family gatherings and the meetings, but there was something I was going to bring up. Oh, you know how the clinic got so popular with the referring doctors? They're all good shotgun people. They shot trap. And during the Depression years, my mother thought it was wonderful because Pop would come home at noon and they'd go for a ride in the country. Didn't have any patience. But the other thing they did was to go to Winona and Toma and Sparta and Viroqua with the other docs in the area and shoot. I don't know if they played golf or something, but then they shot trap and then they gambled. And then they came home, and all these doctors then referred patients in. And I always say it's trap shooting that built the referral practice at Gundersen Clinic. Now, not many people know that, but it's pretty true. It certainly had an important influence on it. But so you didn't know that, did you?